cell disease is a serious blood disorder. It is a condition that affects millions of people around the world, causing significant health challenges and impacting the quality of life for those who suffer from it. The disease is named for the distinctive sickle shape that the red blood cells take on in affected individuals. It's inherited, meaning it's passed down from parents to their children. This genetic transmission occurs when both parents carry the sickle cell trait, even if they do not show symptoms themselves. Genetic counseling can help families understand the risks and implications of passing on this disorder to their offspring. This disease affects red blood cells, the body's oxygen carriers. Normally, red blood cells are round and flexible, allowing them to move easily through blood vessels. However, in sickle cell disease, the red blood cells become rigid and sticky, leading to various complications. In sickle cell disease, these cells become misshapen, resembling a crescent or sickle. This abnormal shape can cause the cells to get stuck in small blood vessels, blocking blood flow and leading to pain and potential organ damage. The sickle-shaped cells also have a shorter lifespan than normal red blood cells, which can result in a constant shortage of red blood cells, known as anemia. This abnormality is caused by a defect in the hemoglobin gene. Hemoglobin is the protein in red blood cells that carries oxygen from the lungs to the rest of the body. The defect in the hemoglobin gene leads to the production of abnormal hemoglobin, known as hemoglobin S, which causes the red blood cells to sickle. Hemoglobin is a protein inside red blood cells that carries oxygen. In individuals with sickle cell disease, the abnormal hemoglobin S causes the red blood cells to lose their flexibility and take on the sickle shape, leading to various health issues. This disease is more common in people of African, Hispanic, Mediterranean, and Middle Eastern descent. It is believed that the sickle cell trait evolved as a protective mechanism against malaria, which is prevalent in these regions. However, while the trait can provide some protection against malaria, inheriting 2 copies of the gene results in sickle cell disease, which poses significant health challenges. Early diagnosis and comprehensive care are crucial in managing the disease and improving the quality of life for those affected. Hemoglobin is crucial for our survival. It is a protein found in red blood cells that carries oxygen from the lungs to the rest of the body. Without hemoglobin, our cells would not receive the oxygen they need to function properly. It acts like a delivery truck, picking up oxygen from the lungs and transporting it to all parts of the body. This process is essential for maintaining the health and vitality of our tissues and organs. As red blood cells travel through the bloodstream, they deliver oxygen to tissues and organs, ensuring that every part of the body gets the oxygen it needs to function. This continuous supply of oxygen is what keeps us alive and active. In sickle cell disease, the hemoglobin is faulty. This genetic disorder causes the body to produce an abnormal form of hemoglobin known as hemoglobin S. Unlike normal hemoglobin, hemoglobin S can cause red blood cells to deform. This faulty hemoglobin is called hemoglobin S. It differs from normal hemoglobin in its structure, which leads to the formation of sickle-shaped red blood cells. These cells are not as efficient in carrying oxygen and can cause various health problems. When these defective red blood cells release their oxygen, they change shape. Instead of maintaining their normal, flexible, disc-like shape, they become rigid and crescent-shaped. This change in shape is due to the abnormal hemoglobin S. Instead of remaining flexible and disc-like, they become rigid and crescent-shaped, like a sickle. This rigidity makes it difficult for the red blood cells to move through the blood vessels, leading to blockages and reduced blood flow. This shape change is at the heart of sickle cell crisis. When sickle-shaped red blood cells block blood flow, it can cause severe pain, organ damage, and other serious complications. Managing sickle cell disease involves treatments to reduce pain and prevent complications, but there is currently no cure. Command. Currently, the VO is 360 words long. The altered shape of sickle cells causes a cascade of problems. These rigid cells get stuck in small blood vessels. Imagine a traffic jam in your bloodstream. This blockage prevents oxygen-rich blood from reaching tissues and organs. This blockage is what causes the excruciating pain of a sickle cell crisis. It's like a sudden and severe attack on the body. The pain can occur anywhere but is often felt in the chest, arms, legs, and back. Sickle cell crisis is more than just pain. It's a systemic attack that affects multiple organs. The blocked blood flow can damage tissues and organs, leading to serious complications. These complications include acute chest syndrome, a type of lung injury, stroke, kidney damage, and vision problems. Repeated crises can weaken the body and increase the risk of infections. The spleen is particularly vulnerable in sickle cell disease. This organ filters the blood, removing old or damaged red blood cells. However, the spleen can become overwhelmed by the constant onslaught of misshapen sickle cells. The spleen can become enlarged and painful. In severe cases, the spleen may become so damaged that it ruptures. A ruptured spleen is a life-threatening emergency requiring immediate medical attention. Section 6. Recognizing the signs, a cry for help. In this section, we will delve into the critical importance of identifying the early signs of a sickle cell crisis. Understanding these signs can make a significant difference in the management and outcome of the condition. It is vital to recognize the signs of a sickle cell crisis. These signs can often be subtle at first, but can quickly escalate if not addressed promptly. Knowing what to look for can empower patients and caregivers to take swift action. Early detection and treatment can prevent serious complications. When a sickle cell crisis is identified early, medical professionals can intervene with treatments that can alleviate symptoms and prevent the crisis from worsening. This can include pain management, hydration, and sometimes blood transfusions. Severe pain is the hallmark of a crisis. This pain can occur anywhere in the body, but is most commonly felt in the bones, chest, and abdomen. The intensity of the pain can vary, but it is often described as excruciating and debilitating. The pain can be sharp, stabbing, or throbbing. Other symptoms include fatigue, shortness of breath, pale skin, and an overall feeling of weakness. These symptoms can severely impact a person's ability to perform daily activities and can lead to further health complications if not treated. Jaundice, which is the yellowing of the skin and eyes, is another significant symptom. This occurs due to the breakdown of red blood cells, which releases bilirubin into the bloodstream. High levels of bilirubin can cause the skin and eyes to take on a yellowish hue, indicating that the body is under stress. If you or someone you know experiences these symptoms, seek medical help immediately. Prompt medical attention can be life-saving. Healthcare professionals can provide the necessary interventions to manage the crisis and prevent further complications. Remember, recognizing the signs early and acting quickly can make all the difference in the outcome of a sickle cell crisis. Section 7. Inside the lab, unmasking the culprit. Laboratory tests are crucial for diagnosing and managing sickle cell disease. A simple blood test called a hemoglobin electrophoresis can identify the presence of hemoglobin S. Other tests, such as a complete blood count, can reveal anemia, which is a low red blood cell count, common in people with sickle cell disease. Regular monitoring helps manage the disease and anticipate potential crises. Section 8. The importance of early diagnosis and treatment. Early diagnosis of sickle cell disease is essential. Newborn screening programs in many countries now routinely test for the disease. Early diagnosis allows for prompt treatment and management, preventing complications. Treatment for sickle cell disease focuses on managing symptoms and preventing crises. This includes pain management, hydration, and medications to prevent infections. In some cases, blood transfusions may be necessary. Section 9. A call for awareness, empowering ourselves and our communities. Understanding sickle cell disease is not just for healthcare professionals. It's a shared responsibility. We need to raise awareness about this disease and advocate for those living with it. Education is key. We need to educate ourselves, our families, and our communities about the signs and symptoms of sickle cell crisis. By working together, we can improve the lives of those affected by this challenging disease.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.